Hey there, Amy here, vestibular physical therapist, and I am here today to talk about why vestibular conditions or dizziness are so hard to diagnose and treat. Now, this is just my opinion as a clinician who treats this condition day in and day out, but I've seen these problems happen over and over, so I really see some patterns here. The first reason why dizziness is so hard to diagnose and treat is because all the symptoms really sound the same between conditions. Generally, the complaints for every vestibular condition out there involve some kind of eye movement problems or difficulty with stabilizing your eyes when you move your head, difficulty with moving visuals, moving surfaces, and sensitivity to head movement. Also, while not every person feels dizziness the same way, dizziness generally fits into the same category for every person, which is a sensation of movement that doesn't match the situation, and patients generally have all the same complaints of dizziness. The second reason why vestibular conditions are so hard to diagnose and treat are that our tests, even in 2023, are not sensitive enough to pick up on most problems. Yes, we have tests to measure the pressure inside your ears. We have tests to measure how well your vestibular nerve is functioning under a certain condition. And we have tests that measure how well your eyes can keep up with your head, but they oftentimes come up negative even when a patient is feeling dizzy for vestibular reasons. And the third reason why these conditions are hard to diagnose and treat is that every single person experiences and describes how they feel about dizziness differently. For the same vestibular condition amongst people, you might have one person who describes that they feel spinning, while another person describes that they feel floating sensations or lightheadedness, and what tips off your symptoms may not tip off another person's symptoms. So it makes it really hard to really pin down those patterns and diagnose a specific condition. So if you have dizziness that's been really difficult to diagnose, keep your chin up and keep pursuing answers. Sometimes you won't get a diagnosis, but you may find some good management strategies and things that alleviate your condition. My advice to people who have unexplained symptoms is to try vestibular physical therapy to address the symptoms. You can find a vestibular physical therapist near you at vestibular.org and search your zip code.